press. Before we begin our briefing this morning, let me just take a moment to mention some practical details. Please ensure your name and the media app that you represent are visible on your Zoom profile. To ask a question, please click raise hand and we will come to you in due course, time permitting. And please also do make sure that your microphone is connected or active on your computer. Thank you for your patience. We will begin in a few minutes. Good morning, good afternoon, and thank you for joining us. My name is Banu Patnagar, and I'm the Press and Media Relations Officer for WHO Europe, moderating this press briefing today from London. So, welcome to WHO Europe's COVID-19 online press briefing from Copenhagen, London, and Bucharest. Before handing over to the Regional Director, Dr. Hans Kluge, to make his opening remarks, let me also introduce our in-house experts who are ready to take your questions as well. We have Dr. Catherine Smallwood, COVID-19 Incident Manager in the WHO Health Emergencies Program. We have Dr. Siddhartha Shankar Datta, WHO Regional Advisor for Vaccine Preventable Diseases and Immunization. And we will also hear from Dr. Dorit Nitsan, our Regional Emergency Director, who is in Romania to support the country's COVID-19 response. Thank you, all of you, for sharing your time and your insights today. So without further delay, Regional Director Hans, you have the floor.
Good morning, good afternoon. Today, every single country in Europe and Central Asia is facing a real threat of COVID-19 resurgence or already fighting it. The current pace of transmission across the 53 countries of the European region is of grave concern. COVID-19 cases are once again approaching record levels, with the more transmissible Delta variant continuing to dominate transmission across Europe and Central Asia. Last week, with nearly 1.8 million new cases and 24,000 new deaths reported, Europe and Central Asia saw a 6% increase and 12% increase respectively as compared to the previous week. Over the past 4 weeks, Europe has seen a greater than 55% increase in new COVID-19 cases. Last week, Europe and Central Asia accounted for 59% of all cases globally and 48% of reported deaths. Cumulatively, there are now more reported cases, 78 million, in the European region than in Southeast Asia, the Eastern Mediterranean, the Western Pacific and Africa combined. We are once again at the epicenter. We see increasing trends across all age groups. Of most concern is the rapid increase in the older population groups since week 38, and this is translating into more people with severe disease and dying. Currently, 75% of fatal cases are in persons aged 65 years and above. Hospitalization admission rates due to COVID-19 more than doubled in 1 week, based on WHO Europe's latest data. According to one reliable projection, if we stay on this trajectory, we could see another 500,000 COVID-19 deaths in Europe and Central Asia by the 1st of February next year. And 43 countries in our region will face high to extreme stress on hospital beds at some point through the same period. So why has Europe and Central Asia been experiencing soaring cases for 4 consecutive weeks? There are 2 reasons. First, insufficient vaccination coverage, and second, the relaxation of public health and social measures. First, vaccines continue to save thousands upon thousands of lives. Despite near record COVID-19 cases, new deaths are at approximately half the peak levels. And this reflects the life-saving effects of vaccines and the Herculean task of health authorities, health workforce and communities to develop, administer and accept vaccines. 1 billion doses have now been administered in Europe and Central Asia. Countries of Europe and Central Asia are, however, at various stages of vaccination rollout. On average, only 47% of people have completed a full vaccination series. While 8 countries have now exceeded 70% coverage, in 2 the rate remains below 10%. Where vaccine uptake is low, in many countries in the Baltics, Central and Eastern Europe and the Balkans, hospital admission rates are high. This variation in vaccination coverage reflects several issues around immunization service delivery, as well as a lack of trust and or complacency by some population groups. It is imperative that authorities invest all efforts to accelerate the pace of vaccination rollout. We need to make sure countries with low vaccine coverage among priority groups increase their coverage. Authorities are encouraged to offer an additional dose to moderately and severely immunocompromised people 1 to 3 months after they complete the primary vaccination series, and to consider offering an additional dose of COVID-19 vaccines to all people over the age of 60. In addition, I continue to urge countries showing the global solidarity they have been doing through sharing of doses. Hospitalization rates in countries with low vaccine uptake are markedly higher and rising more quickly than in those with higher uptake. Most people hospitalized and dying from COVID-19 today are not fully vaccinated. The vaccines are indeed doing what they were intended to do, preventing severe illness and death. Second reason, the relaxing of public health and social measures. Vaccines are our most powerful asset if used alongside other tools. Reliable projections show that if we achieved 95% universal mask use in Europe and Central Asia, we could save up to 188,000 lives of the 500,000 lives we may lose before February 2022. Testing, contact tracing, the ventilation in indoor spaces and physical distancing remain part of our arsenal of defense next to the rapid, fair and generalized uptake of vaccines by everyone eligible. These are tried and tested measures that enable lives to continue while controlling the virus and avoiding widespread damaging lockdowns. We must change our tactics from reacting to surges of COVID-19 to preventing them from happening in the first place. In the situation Europe and Central Asia finds itself today, I am encouraged to see over the past 2 weeks 23 countries responsibly strengthen social measures, but I'm also concerned that 7 have eased up. Measures should be commensurate with the local epidemiology, but with a widespread resurgence of COVID-19, I'm asking every health authority to carefully reconsider easing or lifting of measures at this very moment. Preventive measures, when applied correctly and consistently, allow us to go on with our lives, not the opposite. Preventive measures do not deprive people of their freedom, they ensure it. In other words, the best way to avoid lockdowns, which is an absolute last resort, is to apply such measures and keep COVID-19 transmission low. As we enter the flu season, we face the prospect of both influenza and COVID-19 circulating. The same preventive measures work against both viruses, and we have effective and safe vaccines for both. We are at another critical point of pandemic resurgence. Europe is back at the epicenter of the pandemic, where we were 1 year ago. The difference today is that we know more and we can do more. We have more tools and means to mitigate and reduce the damage to our communities and society. The current situation and alarming short-term projections should trigger us to act. Ultimately, we are only getting out of this pandemic if politicians, scientists and the public work together. We need to stay cautious, act early on any change and stay ahead of the virus. Thank you.
Thank you very much for that, Hans. As the regional director mentioned, there are concerning surges in certain parts of the European region. And I would like to now bring in our regional emergency director, who is being deployed to Romania, and joins us from Bucharest, where we are supporting the COVID-19 response there. Dr. Nitsan, thank you for speaking to us from Bucharest today and taking some time out of your busy day. Please, the floor is yours.
Thank you very much, and thank you all. And yes, indeed, as you can see, I'm in the car driving from one a place to the other. We have been here, comprehensive team that brings different capacities in vaccine prevention and control and infection control, as well as behavioral insight. We are also going to bring more experts in infection prevention and control next week, and more to come. We have visited different aspects of the community here. We started with the health committee in the parliament, then 2 hospitals. We met with the church, with the patriarch's team, as well as the College of Physicians, Institute of Public Health, local leaders, and community activists, etc. So we are trying to really get a comprehensive understanding of the issues and already marked a clear action plan that is also built upon the work that was done by Heather, our incident management, who was deployed to here more than 2 weeks ago. So together with the country office, the regional office, all of us together are here to work with another director, with Rob Butler from the regional director's office. So thank you so much.
Thank you very much for that, Dr. Nitsan. And I know you'll stay on the line if we have any further clarifications or questions. And we wish you continued success on your important mission in Romania. So now let's move to those journalists calling in, the members of the press. If you have questions, I see some people have already raised their hands, and I will come to you in a moment. But if I may, I will first turn to a question that came in beforehand from AFP, and that's Camille Basvolet, who has asked, why are the number of cases spiraling up in the region? And I know the regional director has elaborated on this already, but perhaps there's more we can say. The question also is it driven solely by non-vaccinated individuals? And what can we actually do to prevent the number of cases to rise even higher? Regional Director, would you like to take this first?
Thank you, Camilla, and good to have you back. Yes, so I will not repeat what I told in the statement, but shortly, 1, the vaccination coverage is not fast and broad enough, and number 2, the relaxation of public health and social measures. And there are a number of points here. There is, of course, the seasonality, that people are gathering more and more back in indoor, crowded, confined, closed places. Then also there may be a delayed effect of the school opening, return to the work with a low mask use, and of course we are the region which is Delta dominant, which as we know now is much more transmissible. Definitely we have to look and act very carefully and quickly on the unvaccinated people through the arsenal of measures that we have. That's why we're establishing the task force to tackle vaccine hesitancy with social scientists, which have been working already over the last year, working with the authorities to find out what are the perception of the people, and then go basically community by community and looking who are the influencers. At the same time, time is running out. So we have to do everything we can to protect our vulnerable people and the elderly people. Many of those we have left behind 1 year ago, and we know better, and that's why I also put the issue forward. You know very well, Camille, that I always have been outspoken on the 3rd dose in our region here, particularly for the immunocompromised people, the elderly people, and now more and more also the healthcare workers and the teachers. Thank you.
Thank you very much, Regional Director. If our other experts have nothing to add here, I'll move on to some questions that are coming in from members of the press. I see Moshe Appelblatt has his hand raised. Moshe, please unmute yourself and ask your question.
Yes, thank you very much, Banu. Yes, I would like to go back to what Regional Director Dr. Kluge said about the situation in the European region. As we know, it consists both of Europe proper, let's say European Union and Central Asia. as regards the European Union, we know that the vaccination rate on average is quite high. I think over 70%, even more among elderly people. And still we have this surge in more infections and overwhelming of hospitals, as Dr. Kluge said. And he also referred to the need for a third booster dose. I just would like to know if there is a kind of new approach from his point of view, because I know that he talked about that before, a month ago and so on, and now the situation is worse. And some countries in the EU, for example, Sweden, my own home country, and also Belgium, I think, are now going to roll out this vaccination, at least of elderly people. I wonder if at some point there will be also a need to do it for, let's say, more for the general population, also for younger people. Thank you.
Thank you, Moshe. Lots of questions there. I will let Regional Director begin.
Thank you. Yes, lot of questions, good questions. So I will start, and then we can go to Katie and Siddhartha. So to kick off, the speech has always been do it all. So vaccines are the tool to overcome the acute phase of the pandemic, but only if combined with public health and social measures. There was never a promise that the vaccines would halt the transmission, but they're effectively doing very well what it was promised to avoid severe form of the disease and particularly to avoid mortality. And that's what we see, that from the people dying in the hospitals, there is a huge difference between vaccinated and unvaccinated people. This is the first point. The second point under do it all is that our speech has been from the very beginning in our region that a third dose should not be seen as something taken away from someone who didn't get the first dose. We absolutely need to get the more vulnerable groups the full doses. And these are either people who are vulnerable by immunity, comorbidities, or those most exposed, like the healthcare workers and the elderly people. So we need full dose, but at the same time, the people who are lined up for the third dose to get it as well. And then the third point, there is more and more transmission also in the schools, which is not standalone. It's always linked with the epidemiological situation in the community. So now there are very clear recommendations also on vaccination for youngsters from 12 years on. And the next step, which is being looked at very carefully, is the group between 5 and 11 years. Thank you.
Thank you. Recording stopped.
Thank you, Regional Director, and I'd like to fully support his points and also add that we do know that the vaccinations that are available for COVID-19 are not 100% effective. And there's a huge variation in terms of uptake, and I'm sure my colleague Siddhartha will say more about that. But it goes hand in hand with the preventive measures that countries have had in place during the pandemic. And what we have seen, especially in some countries in Western Europe and some EU countries, is that those have mostly been lifted at this stage. And we have seen a swell in cases because those preventive measures are no longer in place or are partially applied. And what we have seen as well is that that has not led to the same rates of hospitalization or rates of COVID mortality that we would have otherwise expected without these vaccination programs in place. However, the more cases you have, in crude terms, the more people will end up in hospital and the more people will, in the end, go on to die. So there's a very simple explanation for what's going on. And the broader points are that, as the regional director said, we've got a highly transmissible variant, which continues to evolve and continues to develop its transmissibility. We have many susceptible individuals, including in high vaccinated countries, among younger age groups, but also among adult populations. And this is leading to unpredictable, explosive outbreaks of COVID-19. And that's not where we want to be right now. We want to manage it. We want to get ahead of it. and we want to put in place more preventive measures so that we can get to a more steady state situation. Thanks.
Thank you, Regional Director, and thank you, Katie. So just to build upon where Regional Director and Katie, you have outlined the high vaccination coverage. Wanted to make a couple of points here. We acknowledge the high vaccination coverage of the countries who could reach there, but I think it's an opportune moment for us now to look within the country. A national high vaccination coverage is very much okay, but we need to look into both population group-wise coverage and also population in the total coverage by subnational areas. This is extremely important that every community and every population group, the vulnerable ones in a country, are protected. If they are not, the virus will find them and virus will tell us where we have missed the population. The Regional Director, you have heard Regional Director talk about the booster, the additional dose. These the recommendations from WHO are based on robust body of evidence that has come out from the field. And also this topic is evolving. We are learning more about the booster and additional dose every day. So be prepared that there will be when additional body of evidence appear, WHO will reevaluate this and share the recommendations with member states. We really like to thank the member states who are sharing their research finding with us. We are together in this, and I think everybody will benefit when these data are shared with the global community. The vulnerable population still remain the focus. I think every country, the vulnerable population need to be protected, both with the primary dose cities and also now with the additional dose, as you have heard from the Regional Director. Thank you so much.
Thank you very much, Dr. Datta, Dr. Smallwood, and Regional Director. So I'll take a question from the floor now. I see Gunilla von Hall has her hand raised from Svenska Dagbladet. Please unmute yourself, Gunilla, and ask your question.
Yes, can you hear me?
Yes.
Okay. Thanks for taking my question. I have two questions. You talk about how you're concerned about countries opening up, lifting restrictions and so forth. And Sweden is a country where we basically have no restrictions whatsoever anymore. And 70% of the population is vaccinated. So people feel like the country feels we're safe enough. We can safely open up. We also need to get the economy going. People need to get back to their normal lives and so forth. What is your message to a country like Sweden? Isn't it, after all, a reasonable decision to opening up like we have done? Second question is on the influenza and the risk of having what's being called the twin-demic in the winter. We will have both influenza and new COVID cases. How worried are you about this? And can people go and safely vaccinate themselves against COVID and influenza at the same time, and it will be no interaction between the two vaccines. The efficacy will be kept, and there will be no severe side effects. Thank you.
Thank you very much, Gunilla. Regional Director, would you like to start?
Yes, appreciated, Gunilla. So the principle remains the same, that there is a need to act early on. So not to be reactive, but proactive. And we know more and we can more. But definitely in a context where cases are rising, that's not the time to relax. Simple measures can save a lot of lives, but at the same time, we have an arsenal that permits to keep the society running and protect the livelihoods without going into a lockdown and putting pressure on the virus, which are the personal protective measures, like the 3 Ws: wear the mask, watch the distance, wash your hands. Then there are the system issues, to have the system, which does a very good surveillance, testing, isolation, etc. And of course, the vaccination. So the most important is to be alert and adapt the response according to the local, not only national, but subnational epidemiological situation. But definitely in a situation where Europe is the pandemic, again globally, And if there is a situation where cases go up, there is the need to tighten the measures so that we avoid a worsening of the situation. In that sense, an example is the COVID pass. There's a lot of discussion on the COVID pass. We should see the COVID pass as a collective tool towards individual liberty. So these are not measures which are restricting freedom. In fact, it are measures protecting the freedom so the country is avoiding to go to a harmful lockdown.
Thank you, Regional Director. Dr. Smallwood, would you like to add?
Thank you. Gunilla, I wanted to address your question around influenza and other respiratory viruses. And of course, when we're talking about respiratory viruses in general, we do know that the COVID measures and the preventive measures that exist for COVID have worked very effectively against other respiratory viruses, and especially seasonal influenza, which we've seen a significant drop of over the past 2 years. We are worried, as you said, about possible co-circulation of those two viruses, especially as countries are lifting the measures and the preventive measures that had been in place. We're looking very, very closely at the sentinel surveillance systems that are in place across the region. And you will know also that at the end of the summer, and we continue to see this in some countries, very high positivity rates of viruses that affect children, such as RSV, that were circulating aseasonally. And this is something that we'd be very worried about for the influenza virus as well. We have seen pockets of transmission of flu, not at very significant levels yet, but we're still early on in the season. We're watching these very carefully, and we've got a campaign out to ensure that people who who are particularly vulnerable to flu as well as to COVID-19, make sure that they're aware of the risks. And on the particular question around vaccination, perhaps my colleague Siddhartha will give some clear guidance in that regard.
Thank you.
Richard, please.
Thank you, Katie. So thanks, Gunilla, for asking that question on co-administration of flu vaccine and COVID-19 vaccines. The Strategic Advisory Group of Experts at the global level and the Regional Technical Advisory Group of Experts on Immunization in the WHO European region, they have reviewed the available evidence around the co-administration of these two vaccines. They have suggested that anybody can get both the vaccines together. There is no decrease in the effectiveness of either of the vaccines when given together at one point of time. Let me also highlight what are the advantages of having this co-administration from the practical point of view. A person or vulnerable people who is coming to get COVID-19 vaccination can also be given influenza vaccination at the same point. It's a convenience, but also allows the healthcare system to check who have missed either of the vaccine doses. So you actually get much more benefit in providing as an organizational and a convenience basis for providing these two vaccines together. One point I want to highlight here, the member states need to keep in mind that they are not only doing flu vaccination and COVID-19 vaccination at one point. Health workforce need to be adjusted to provide also a scope to provide a routine vaccination program for the children. So what we are talking about, the twindemic, influenza and COVID-19, remember there is third element that the health system should be geared up to provide or catch up with the routine vaccination programs which may have suffered in some parts of our region. Thank you.
Thank you very much, Dr. Datta. I will take a question we received in advance from the Lancet, Ed Holt at the Lancet, and this is concerning Romania in particular. The question is, there have been reports that Romania's vaccination rate has picked up since the numbers of deaths from this latest wave started to rise sharply. Are you expecting the rate to continue picking up in the coming weeks as the surge and regrettably numbers of deaths continues? I will go first to the regional director and then to Dr. Nitsan in Bucharest.
Thank you, Banu. And Ed, indeed, we have a team on the ground, so I will ask Dori to provide some details. But we are effectively very pleased to see a 23% decrease in the number of cases compared to last week, and in parallel, an increased uptake of the vaccine, now exceeding 40% for those that are eligible. So the dynamics are positive, but of course, the situation is still very, very, let's say, severe. And this, I would say, the key issue there is a unity of purpose. So there is a need for unity of action to get the whole government and society on board across political parties, the government, the opposition, healthcare workers, very important also the media and the religious institutions, which our team is also engaging with, teachers, civil society and the citizens. So in that sense, as in a number of other countries, it's all hands on deck, including in the hospitals, very important, also to make them fireproof, and looking ahead, and I know I'm in daily touch with the authorities in Romania, that the authorities are also looking ahead then on strengthening the primary healthcare and the ambulatory system as part of the response and recovery fund, because ultimately that's the best line of defense, be it to any form of emergencies or other diseases. Thank you.
Dr. Nitsan, please, would you like to add?
Yeah, thank you. Thank you, Regional Director. And indeed, we see on the ground the increase in vaccination coverage. And we saw a spike over a week, and now it's kind of becoming steady. And it's okay if it will continue like this. So lots of effort are being made at different levels from the president through different stakeholders to ensure that it's going to work. Our team here is looking at the behavioral insights to learn more how to harness the people, the communities, but also the media and the opinion leaders so that everybody will join that task. It's important because the numbers, it's so sad to see the hospitals. It's so horrible to see the burden and the death and the tears. So we are really asking the people to save themselves and save others while keeping the livelihood. Thank you.
Thank you, Dr. Nitsan. So let's move on to another question now from the floor. Can I ask Helen Collis from Politico to unmute herself? And please go ahead, Helen.
Hello, thank you. I just wanted to ask one question. It was specifically about the WHO Europe's recommendation on boosters. I know you've touched on it a few times. I just want to be clear exactly who you are recommending should receive it, because you've mentioned healthcare workers a couple of times, but not every time. I just want to be clear. Thank you.
Great. Clarification is always good. So I will hand first to Regional Director and then any other expert who would like to take the floor.
Thank you. So we'll go straight to, because it's a second question, let's go straight to Siddhartha.
Great.
Thank you so much. Thanks, Helen, for that question. As I have mentioned, that there are two topics around. One is additional dose, and the other is a booster dose. Let me take a half a minute to go through that process. One is additional dose. WHO has looked into the waning of immunity in the population group who have received inactivated vaccines, which is the Sinopharm, Sinovac, for example. And the global advisory group of experts have suggested that these population groups which have received an inactivated vaccine need to have an additional dose, within 1 to 6 months of the completion of the primary dose series. The booster dose, for example, are being provided to the people who are immunocompromised, as you have heard from the regional director, for those who are moderately or severely immunocompromised. These population groups should receive a booster dose between 1 to 3 months of the completion of the primary dose series. And we'll be very happy to share the link with you, which goes into all the technical details, in a separate email, should that be of interest. Thank you so much.
Thank you very much, Dr. Datta. I can go now to Lauren Chadwick, Euronews.
Hi, thank you so much. I was wondering for Dr. Nitsan, in your conversations with community members in Romania, have you spoken to people who refuse the vaccine, and are there methods that work in convincing them to get the jab? And then my second question is just on transmission. I was wondering, in countries with mandatory vaccinations for certain public events, this COVID pass, I'm wondering if we're still seeing transmission in restaurants and kind of public events. Thank you.
Thank you very much. Dr. Nitsan, did you hear that question?
I heard the question. Thank you very much for this. Yes, indeed, we have spoken to few people that really would like to learn more about the vaccines and to understand their safety, and especially among pregnant women, etc. So there were specific questions. We provided the data and the information, and we will further look into more organized way to team up with the health workforce and to provide them with the support needed to explain what is needed. We feel that in some areas, probably it's a matter of knowing and having access to the information. In others, it's belonging to specific groups that we need to know how to communicate with. Our experts in the field will give us more insight on this with time.
Thank you. Did anyone want to add? No. Okay, great. Thank you very much to our panelists there. I go now to Nikolai Skiersgaard from Reuters. Nikolai, please unmute yourself.
Hello, everyone. Can you hear me?
Yes.
Okay, good. Keeping Romania in mind, and also just the general surge in cases across Eastern Europe, is there any kind of, does that have any ramifications for the rest of the Europe region? Is it sort of causing, is there any flow from Eastern Europe towards the rest in terms of transmission, that, or is this a general rise across the region? Thank you.
Who would, Dr. Dorrit, would you like to take that, or?
Yes, thank you very much, Banu, and thanks for this question. Indeed, every community that is not vaccinating is posing a risk for the rest of us, the rest of humanity, and we see those communities all over Europe. In some countries, it's more pronounced right now, but as we discussed, the vaccination coverage is increasing here, and we hope to see good impact. But we really have to join hands and help the people to make the right decision, while keeping, as our regional director really emphasized, while keeping the public health and social measures in place and ready to be activated and tailored to the situation. Every case is a risk for us all. Thank you.
Thank you very much, Dr. Nitsan. And if I may, I'd just like to return to a previous question, because I don't think we fully answered it from Lauren, actually, with regards to are we seeing transmission in restaurants and public events. So, Dr. Smallwood, would you like to come in there, please?
Thank you. Perhaps I'll take these two questions together, because there's some very specific points. The question around, is Romania driving transmission in other parts of the region? No. I think we need to be very clear here. Transmission is high in many countries across the European region. The presence of the virus across the region at the moment is very high, not just in one country. Of course, Europe as a continent is highly interconnected. More so maybe than other regions, and this may also be a factor in the way that the pandemic evolves. Now, that's why it's of course very important for, as the regional director said, us to rely on a comprehensive set of preventive measures that include rapid increasing vaccination rates in high-risk groups. And thank you to our regional emergency director for mentioning pregnant women. We are seeing far too many pregnant women hospitalized with COVID-19 across the region at the moment. And this is one of the groups where we need to do more to explain to them the benefits as well as the risks of COVID-19 vaccination. And when it comes to the preventive measures, restaurants, public spaces, public transport, these are all areas where the virus will continue to transmit. Whatever the measures we have in place, we do know that we're not going to get to zero transmission at the moment. But what we can do, and what certain countries are continuing to do, using, for example, the COVID passes in public spaces or large events, is reducing the risk. And reducing that risk is really important. It's not just through vaccination mandate, it's also through testing, through recovery certificates. And this is something that countries are taking decisions on based on the current situation in their countries. Some countries have lifted those mandates given the very high vaccination rates. Other countries are continuing with them. And these are very much decisions for each country to take on the basis of the current situation there. But the basic measures, the preventive measures at the individual level, at the community level, those measures that prevent COVID but don't prevent us from going on with our daily lives, those are the most important, because together with vaccination, those can bring the transmission down to manageable levels.
Thank you, Dr. Smallwood. Dr. Datta, did you want to add anything on mandatory vaccinations?
Thank you, Banu. Thank you. And thanks for that question, Lauren, on the mandatory vaccination. WHO has already been telling that the measures that need to be put in place should be directed towards a rapid scale-up and high vaccination. The country context makes a big, has got a big influence in what countries, what steps they will put together to ensure that the high vaccination coverage really happens. Mandatory vaccination is just one tool that the country can consider in ensuring a high coverage. But while this decision is being made to ensure the country have a process for mandatory vaccination, it's optimal and prudent to learn what are the different factors around demand and acceptance of the population group to receive the vaccine. If we don't address the population's issues around demand and acceptance, having a mandatoriness nature of the vaccination will just only do thus far to reach the vaccine or to scale up the vaccination. So it's extremely important that we learn what the concerns are and address them in a very trustworthy and openness or transparency in sharing of this information. Only by doing so, this tool of using a mandatoriness of the vaccination will bring the coverage high. Thank you so much.
Thank you very much. So let's move swiftly on to our next question. Sarah, if you could unmute yourself. Sarah from The Telegraph, I believe. Is that right?
Yes, from The Telegraph. Thanks so much for taking my question and for doing this today. I just want to go back to something that Dr. Hans Kluge said in his introduction about the modelling that suggests that 500,000 people could die in Europe and Central Asia by February. Could you just tell us a bit more about where that's from? Do you have a figure just for Europe, split separately from Southeast Asia? And do you also have any country breakdowns of where in the continent might be worst hit by that? Thanks.
Thank you, Sarah. So, modeling is always very, very complex, and predicting the future trajectory of an infectious disease, particularly in this situation where we have a decreasing immunity, we have variable uptake of the boosters, and the behavior of the people is different. What we can say is that we may well look at a situation of high volatility, where we're going to see further spikes, and then the spike will go down because the people are reactively, but for each spike, we're going to leave people behind. So the whole issue is to be not reactive, but proactive, particularly in an epidemiological situation where we see that the pandemic is not under control. On the source, it's one of our centers that we collaborate with, IHME, the Institute for Health Metrics and Evaluation in Seattle, Washington, and we have also indeed sub-regional projections and then country by country, and we are organizing policy dialogues on a sub-regional basis. So a projection is only a projection, but the trend is clear. What's very important is that we know that if we would drastically increase the mask use, at least in indoor places, which is a very cheap and effective tool, we could save so many lives. The projection is about 188,000 by the 1st of February. And that is the key message, that it's vaccination, but also the public health and social measures, and expressing empathy to the people who are rightly so tired of the pandemic. But again, we do have the tools, and we see in a number of countries that if the toolbox is implemented comprehensively, that both cases and deaths are decreasing.
Just really quickly, is it possible that you could share with us those country and sub-regional projections?
You're very welcome to contact us, Sarah. Thank you.
Yeah, Sarah, I will try and get those to you later today.
Thank you.
Great. Moving along, Frank Hoffman, if you would like to unmute yourself and also introduce your media outlet, please. Hello, Frank.
Yes, hello. Thanks. Sorry for that. Thanks very much for taking my question. I'd like to know, Regional Director, did you have a look into the communication policies in different European countries, thinking about that in the Baltic states, in particular in Latvia, a lot of transmission is obviously happening among unvaccinated people of the Russian-speaking minority, knowing that they are living in a Russian language bubble there.
Thank you. Regional Director?
So what's the question exactly, Frank?
Hans, the question is, have you looked into the communication policies of different European and Central European and Baltic countries, knowing that in Latvia, for example, many transmissions are happening unvaccinated people amongst the Russian minority?
Yes, thank you, Frank. It's part of the comprehensive approach. We're always following a system approach, and definitely communication has been at the top of the agenda. You mentioned the Baltic states, but what you're describing, indeed, we have in quite a number of countries, and by the way, not only in Eastern Europe. So it's a very legitimate question, which I'm going to hand over to Katie, Dr. Smallwood.
Thank you, Frank. And just to add that our work in support of our member states, we work very closely with the ministries of health in all of the countries, and we have materials available in a whole range of languages, and particularly in the WHO Europe region. Of course, Russian is a language that is one of our official languages, and all of our materials are shared in those languages. We also work with national counterparts to ensure that communications materials are adjusted and translated into local languages to make sure that all population groups are receiving the same information. So it's a really good question, and something that we do address on a continuous basis.
Thank you. Dr. Datta, would you also like to add anything?
Thanks, Banu. Yes, I think I can add on to what Katie and the regional director have mentioned. Our engagement with our member states and the National Immunization Program units is to understand, as I was mentioning, the inequity in population groups and also the subnational areas in every country of the region. We do engage with our member state just to understand this inequity, how can we measure that, and what are the different interventions tailored to the local settings that can happen. Irrespective of the language spoken by the country or the population group, it also includes whether they are being left behind. And I think the most important thing is that none of the population groups in any of the countries should be left behind due to one reason or the other. And that is what we say, tailored intervention to the local settings, only if we know the local challenges. And this is what we say, data for action. This is what the WHO Regional Office of Europe, along with our country offices, are working with all the 53 member states. Thank you.
Thank you. I see Jamie has put his hand up. Jamie, please take the floor. Jamie from AP.
Hi, thank you very much. Good morning. I wanted to just ask Dr. Kluge and Dr. Smallwood to possibly comment on the impact of the vaccine approval process by WHO. In particular, yesterday we had the announcement about Covaxin, which has been given the go-ahead, and of course we're still waiting on Sputnik, which. So if you could just address, the impact of those decisions on getting vaccination rates to go up, because obviously that's one of your main ambitions. And in particular, what are you doing, if I could just maybe specify, what are you doing to try to get that Sputnik vaccine, accelerated through the process, if anything? Thanks.
Thank you, Jamie. Good to have you back. So, number of points here. That, as you know, I never stopped traveling during the pandemic and really engaging with the countries, the communities, healthcare workers and the authorities in each country. And one of the points I always make, particularly in those countries where there's quite a bit of vaccine skepticism, is that it's important to broaden the portfolio. So it's important to broaden the portfolio and technologies to increase scaling up of the vaccines, but also the trust of the population. So what happened yesterday is obviously a very, very good news, particularly as the vaccine is to be stored between 2 and 8 degrees Celsius, which then particularly for middle and low income countries is a key asset. There are 16 more in the pipeline and everyone counts. We need to increase uptake, sharing and production. So it's a comprehensive approach. On the Sputnik, this is now directly in the hands of WHO Geneva, but Siddhartha can tell a little bit more about this. There have been assessments, and then the Russian Federation is pulling together some additional data to be sent to WHO Geneva, and Siddhartha will have some more details on that one. Thank you.
Thank you, Regional Director. And Jamie, thank you for that question. As you are aware, Jamie, that the WHO UL process is done on a rolling data submission basis. Means we evaluate the data as those data become available from the applicants as they come in. There is no preference around one product type or the country of origin of that vaccine. WHO provides comprehensive feedback on the gaps that we see during the evaluation process and also on the completeness of the documents that are being submitted. The decision on this listing, on the emergency use listing of the vaccines are based on the complete information to confirm the safety, quality and efficacy. And they are also being done in parallel as we review the other regulatory authorities and agencies overseeing the vaccines. As you are also aware, when you asked, where are we? The progress in the regulatory review by WHO is updated regularly and also is available for the public domain on the WHO UL PQ evaluation process. We are working with Gamaleya Institute and as we do for other vaccines to get all the comprehensive data, and WHO can only speak about the attributes of the specific products when we have complete data set and that is being evaluated by the technical advisory group, which supports WHO's EUL process. Thank you.
Thank you very much. A question from Tom Magner now, Carers World. Tom, please unmute yourself.
Thank you, Banu. I'd like to go back, Dr. Kluge, to your remarks in your statement where you appealed to politicians, scientists and the public to work together. Perhaps I could use England as an example. What we seem to have here is that scientists by and large are trusted and considered to be on the ball. But what we have, it appears, is the ruling party ideology is in favour of relaxing restrictions. And that seems to have tapped into an understandable impatience on the part of people to get back to what they consider to be normal. What do you feel that this type of situation says about society and the chances of ever being able to consider COVID-19 as, once again, was in the background, effectively pre-pandemic? Thank you very much.
Thanks, Tom. I think it comes back to the issue of trust from society into governance, and this is extremely important. And we have seen different examples, not only in the European region, but globally. That's one of the things for WHO also to improve in their Global Health Security Index. Because we saw in several countries where they ranked quite high on the Global Health Security Index, which tells how much a country, a health system is prepared, that some of those countries saw their health systems overwhelmed. Because one very important factor which was not calculated was the political situation and the political governance. So the point, and I'm not speaking about the UK here, but in general, is distrust between politicians and science is key, and scientists to understand that when they provide evidence, it has to be in a way which can be communicated easily both to the public and the politicians, and for the politicians to communicate science as well. In countries where we see that there is a good balance between politics, science and ethics, for me that's the key. Politics, science and ethics, the response to the COVID-19 is much more favorable. But in countries where politics is ignoring sound evidence, the suffering is much bigger. So we're only going to get out of the pandemic if politics, science and the people are pulling in the same direction, and clear, frequent, consistent communication is very important here, including, like for example in our host country Denmark, which has been doing it consistently very well, to communicate what is not known yet, because it's important to explain to the people that these are unprecedented times. So this is new. So in that sense, science is by definition iterative, and we have to communicate this to the people. Thank you.
Thank you very much, Dr. Kluge. Time for just one final question that we received in advance. This one's for you, Dr. Kluge. It's from a Belarusian journalist commenting about the government in Belarus having abolished mask mandates at a time when COVID-19 cases are rising. And they would like to know what WHO would like to say about this. Over to you.
Thank you, Banu, and to the journalist. As some of you may know, 2 weeks ago I was in Belarus, so to attend the meeting of the ministers of the Commonwealth of Independent States, and I also went with the Minister of Health, among others, to the Minsk City Infectious Disease Clinic, which was reprofiled for COVID-19, where majority of the people in the reanimation were non-vaccinated, and we had a discussion with this with the leadership of the country. So in that sense, first and foremost, my thoughts are with all people of Belarus who are suffering as a result of this pandemic. COVID-19 has not spared anyone, so it's very important that the people of the country know that we stand in solidarity. And then I was mentioning previously, if there is a situation where the cases are rising, where the epidemiological situation becomes more difficult, this is not the time to lift public health and social measures. Of course, the economy and the microeconomy and the livelihood have been safeguarded, but masks is an effective and cheap way to prevent transmission and ultimately save lives. So, and remember the projections I gave with one of our collaborating centers, that if wearing of masks would increase to 95%, like some countries in Asia are doing, that this could save up to 180,000 lives by the 1st of February. So we have to be very, very proactive in difficult epidemiological situations to be the virus one step ahead.
Thank you very much. And that brings us right to the top of the hour. On this note, let me close the press briefing for today. Thank you very much, Regional Director. Many thanks to our panelists, Dr. Smallwood, Dr. Datta, and Dr. Nitsan in Romania. And thank you to you, members of the press, for dialing in and for joining this press briefing. If you do need additional information or follow-up, please contact us by email using the details that were provided in the invitation. And as always, stay healthy and take care. Goodbye.